So I'm going to present you 3 different clinical cases, but before, I would like to set some background. Follow the clinical guidelines of the ESE that were published in 2019, because as Dr. Banerjee said, it's very difficult to differentiate between reversible and irreversible pulpitis. There's the article of Waters in 2008 who states that he make a new classification of 4 different types of pulpitis. That's very difficult also, but we have to relieve in something. No? So I think that this is very clear. You have a bite wing radiograph, and if you have a superficial or shallow lesion, okay, you can go for non-selective removal. You can go until hard dentil. You can hear like the dentinal, I don't know the name, shout, no? I don't know the name in English, but you can go to hard dentin.